Good afternoon. Today's topic of presentation is single visit endodontics. There is always a debate whether you should go for a single visit endodontics or multiple visit endodontics. The contents of today's presentation is introduction, definition, history, guidelines, criteria for single visit endodontics, Woolage criteria for case selection, indications, contraindications, reasons for not doing single visit, and reasons for reaccepting of single visit endodontic therapy. Practice management advantage, patient advantages, disadvantages, techniques for cleaning and shaping used in single visit, criteria for post-operative pain evaluation, single visit versus multiple visit root canal treatment, post-operative pain, flare-ups, success versus failures, myths associated with single visit, recent advances, conclusion and references. Introduction. The main objective of performing root canal therapy is to eliminate bacteria from the infected root canal system or remove inflamed pulp tissue and close it with a biologically acceptable filling material. The treatment is managed well regardless of the number of visits. It would create a favorable environment for healing. The recent advances in endodontic technology attracts the practitioners as well as endodontists to perform the root canal treatment in a single visit. Nowadays, with the invention of new techniques like microscopes, endomicroscopes, loops, endomotors, nickel titanium files, endomotors, and different sophisticated instruments, more and more people are now doing single visit endodontics. Definition: single visit endodontic therapy is defined as the conservative non-surgical treatment of an endodontically involved tooth consisting of complete BMP and obturation of the root canal system in one visit. History: Dodge described various techniques for single visit. Starts from 1904, goes to the latest techniques. Success in endodontic therapy is based on accurate diagnosis. Proper case selection is very important. Use of a skilled technique of treatment. Guidelines for single visits are should not be undertaken by inexperienced clinicians. English should understand the endodontic principles and ability to exercise these principles fully and efficiently. The case should be one that can be completed within 45 to 60 minutes. The treatment which takes longer time should be completed in multiple visits. These are criteria for SVE. Case should be one that can be completed within 60 minutes. Clinical experience, patient cooperation, accessibility, anatomic variations, calcified canals, pulpal status, apical lesion, clinical symptoms, presence of a sinus. Woolage criteria, that is positive patient's acceptance, sufficient time available to complete the procedure, absence of acute symptoms requiring drainage via canal or persistent or continuous flow of exudate or blood, absence of anatomic obstacles, calcified canals, fine tortuous canals, procedural difficulties, leads, blockage, perforation, and inadequate fills. The indications are intentional root canal therapy, vital pulp exposure due to caries or trauma, teeth requiring immediate post placement, teeth with subgingival breakdown. Contraindications are teeth with anatomic anomalies like calcified canals, curved canals, patient with allergies, patient unable to open the mouth for a long time, teeth with limited access, weeping canals, etc. Reasons for not doing single visit endodontics: fear of post-op pain, fear of failure, lack of time, lack of experience, lack of equipment, fear of being unconventional, not economically viable. Patient advantages are patient comfort, economics, restorative considerations. Disadvantages are tiring for the patient, clinician fatigue, inexperienced clinician, flare-ups, not possible in all cases, cannot place an intracanal disinfectant other than the use of sodium hypochlorite. Techniques, there are different techniques like the crown down technique, hybrid technique, double flare technique, and the modified double flare technique. The patency is checked even in between any all the procedures. Single visit versus multiple visit. Use of extra disinfecting agents, that is intracanal dressing besides Regen's aims to reduce or eliminate microorganisms and thereby byproducts from the root canal system before the observation. The most intracanal dressing researched and widely used is the calcium hydroxide. The disadvantage of multiple visit is inter-appointment contamination and flare-ups caused by leakage or loss of a temporary seal. Prolonged time taken, leading to patient fatigue, operator fatigue, inability to provide aesthetic restorations in time. Moreover, the tooth may be susceptible to reinfection through the temporary filling and dressing during the interim period of time. In addition, the antimicrobial activity of the sealer or the zinc ions of Gatapacha can kill the residual bacteria. Postoperative pain. Fear of postoperative pain following treatment is the biggest factor in avoiding single visit endodontic therapy. Flare-ups is an acute exacerbation of pulpal or periapical pathosis after the initiation or continuation of the root canal treatment. Success versus failures. Different examples. Valtimo et al. Found no remarkable difference between the two treatment groups. Effectiveness of this is another case report showing the effectiveness of single versus multiple visit endodontic treatment of two mandibular central incisors from the same patient. There are certain myths associated with single visit endodontics that canals are cleansed if an antibacterial medicament such as calcium hydroxide is left in the tooth. All these myths have to be considered before you start with the single visit endodontics. There are certain advancements have come, like we should have the latest technique and instruments for attempting single visit endodontics. Finally, to conclude, with the advent of technological advancement and emergence of new gadgets, evidence-based dentistry and more scientific deliberations of and the concept of maximum dentistry in minimum visits led laying down of various protocols enabled dentists to venture into single visit endodontics. The incidence and intensity of post-operative pain and the long-term success rate for single visit and multiple visit are similar. Single visit treatment can be more comfortable and an efficient option for the patient as well as the clinician. Thank you.